All right, in this quick video, we're gonna talk about whether to use ice or heat or some combination of both throughout injury recovery or just for general wellness, for aches, pains, tight muscles, things like that. And we'll break down exactly when to use them so you can heal smarter. So having been through numerous injuries and surgeries and anything in between, I've definitely iced when I should have heated and heated when I should have iced.
Now think about that, that's crazy.
So here's a simple quick guide on how to make the most out of ice and heat and how to not make those same mistakes. So starting off with ice, whether it's an ice pack like freeze sleeve, one of my personal favorites, or an ice bath, being immersed in ice, you generally want to use it for new or acute injuries like a rolled ankle, twisted knee, or something that's kind of inflamed or swollen. You can also use it after physical therapy or a tough workout if something's feeling really off, just to really reduce that inflammation and swelling.
Ice! Ice!
In general, ice does a number of things, but primarily helps reduce that swelling, inflammation, slows that blood flow to that inflamed tissue, and really can kind of ease that pain temporarily with that numbness of the nerve endings. And you typically want to do it for about 15 to 20 minutes on with a cloth in between your skin, so you don't want to put it directly on the skin. Then you can wait about an hour and repeat. If you're especially sore, you can actually do 20 minutes on, 20 minutes off, ice, take it off, ice again for another 20, and kind of repeat that and hopefully calm some of that inflammation. So next, looking at when to heat. So you can use a variety of different heat packs. So you have ones that go in the microwave, you have this that plugs into the wall, different heat settings. So you want to keep it generally kind of warm and not too hot. You can also use things like a bath or a hot tub. And in general, you want to use that heat for more chronic types of injuries. So think of low back pain that's really naggy, sore muscles, chronic stiffness.
Oh, I'm hurt! Oh, my neck! My back! My neck and my back! Oh!
Tight muscles, things like that, because the heat really helps loosen it up. So for example, you have a really kind of chronically tight hamstring.
Hold on, I gotta warm up. I don't want to pull a hammy.
Heating that before exercise or PT would be great. So in general, heat loosens things up, it increases that blood flow, relaxes those tight muscles, and can help with that stiffness from old or lingering injuries. In addition to those, it's really great for muscle spasms, joint stiffness, and just really warming up before a workout or stretching. And you can use it similar to ice where 15 to 20 minutes on. You generally want it warm, not scalding hot, but you can also do a bath, shower, or hot tub would be ideal if you want to be immersed. Next, we'll touch on when to avoid each. So you generally want to skip ice right before a workout, or if you have circulation issues, or if you're trying things like acupuncture or dry needling, those create kind of a micro trauma, mild inflammation to bring blood flow. So icing right after those would be kind of counterproductive. Next, when to skip heat. Really, if the injury is new or swollen and really inflamed, you don't want to bring more blood flow there. You want to reduce that inflammation and swelling.
My shoulder doesn't hurt very much, but my face does. Right here. Not here or here so much, but right here.
Nope. Ship shape.
Also, after something like a cortisone injection, you do not want to necessarily increase that blood flow. That would kind of counteract the anti-inflammatory effects that you're going for with something like that. So as a general rule of thumb, for swelling or a recent acute injury, you're going to want to ice, calm that inflammation and swelling. If you have tightness or chronic issues, you're going to want to use heat to try to loosen those up. Next, we're looking at, can you alternate between ice, heat, ice? And yes, definitely, it's called contrast therapy. It's really great for lingering injuries or general wellness.
You don't have to be an athlete to enjoy the benefits of contrast therapy. It can be an effective practice for anyone suffering from chronic pain and aches. Some benefits include improved circulation, decreased swelling, reduced inflammation, and so much more. I'll do 3 rounds, 15 minutes in a sauna, 2 minutes in the plunge. I do this 3 to 4 times per week.
And with that, it's generally recommended to start the contrast therapy with heat and the heat phase and then transition to cold. So we have a separate video over here about the details of contrast therapy and really how to use that effectively. But below, we'll give a quick high-level overview on how it works and how it's beneficial. And so the idea with heat first is that initial heat exposure can really help relax those muscles, increase that blood flow called vasodilation, and really improve circulation, kind of preparing the body for that cold exposure. And then ending with the cold phase is just really helping to reduce that inflammation, constrict those blood vessels called vasoconstriction, and potentially reduce that inflammation, that lingering inflammation or swelling. So if you happen to have access to a hot tub and a cold tub, that would be really ideal for contrast therapy to be immersed in the water. So here's a quick example of how that would work if you have access to that. You'd begin with a hot tub that's around 104 degrees or so, generally a hot tub temperature, for 3 to 4 minutes. Then you would switch over to the cold tub for 1 to 2 minutes. It's usually about 46 to 50 degrees. You can do it longer if you can take it, and then switch back to the hot tub for 3 to 4 minutes. You could do that for 4 to 5 cycles. Don't have to. That'd be about 20, 30 minutes total, then finish in the cold tub. And that really helps with that inflammation reduction, reduce that swelling, kind of help those muscle soreness and things like that. Quick recap is ice, ice. In the first 48 hours of an acute injury, swelling, inflammation, things like that, definitely use ice. For heat is for stiffness, sore muscles, chronic tightness, things like that. And you're gonna wanna avoid heat with fresh swelling or an acute injury, and you're gonna wanna avoid ice right before a workout. Those are a couple quick high-level tips. Also, if you have any ways that ice or heat or contrast therapy really helped in your recovery, or if there are certain products that really helped throughout your journey, throw those in the comments. And if this video was helpful, please subscribe. We appreciate you watching, and we'll see you in the next one.